Good morning, everyone. It's Mackenzie again for Tooth Talks here with Dr. Wageman. We're going to ask some more questions if you guys are interested. He's just around the corner here, so I'm going to step back and let him in.
Yay! How's it going today?
I'm good. How are you?
Excellent.
So we've got a new question today, and it's a little less complex. We're not going to dive so deep into it.
I understand that this time you know what the question is, and I don't.
No.
Last time, neither of us knew what the question was until right before.
Exactly. So I was just wondering the difference between a floss stick and rope floss and the pros and cons to each, or what you would recommend.
Oh, cool. Okay, so I think about my dad, who was a dentist, and he used to say that it doesn't matter what you get your teeth clean with as long as you can get it clean. In fact, he would say, like, if you can scrub your teeth with a corn cob and it's clean, then we're good. And there's some truth to that. So what we see happen between the teeth is that you have bacteria that live in your mouth, and it's impossible to get rid of them. They're supposed to be there, and they can actually be helpful to break down your food. But when they get to places where you can't scrub them off, they use sugars to create a sticky sort of capsule that they can adhere themselves to the teeth with. And we call that a biofilm. And what's true about the biofilm, it's like a slime layer on rocks if you've ever tried to cross a creek in your bare feet and it's all slippery, is that it will kind of allow the creek to go by really fast. But in that little layer on the rock, the bacteria that's living there that made the slime, it doesn't get swept away in the creek. It gets to live on the rock. And so on your teeth, between your teeth, there's a little bit of slime there, and the bacteria gets to live there forever. And when it eats sugar, it makes acid. And it puts the acid into that slime, and then the acid works like toilet bowl cleaner to remove minerals, and it removes the minerals from the teeth on either side. So what you're doing with floss is you're just going through that slime layer and you're disrupting it, and you're adding oxygen in there, and you're getting rid of that, and the house that was built by the bacteria is gone. Your saliva can go in and mineralize it. And so the question about which is better, rope floss or floss stick, really comes down to which one are you going to use. A lot of kids have a hard time like doing the whole dexterity thing, and what will happen is they grab the floss the way you would grab a piece of string, and when they're using it on their teeth, they're not close enough and they snap their gums and it hurts, and so they don't floss. So sometimes it's nice to get those little floss sticks, or the ones that have like Gum Chucks, or is a brand where you use actually two sticks with a little piece of floss, and so you can get in there really tight. And if you have questions about how to do that with the rope floss, we actually coach people in the office all the time about what finger to wrap the floss around and that sort of thing. But I hope that answers that question. And I wanted to just apologize sort of about last week. I learned something because I watched my own video and I called fluoride a molecule, which probably doesn't matter to most people. But when I saw myself say that, my immediate reaction was, who is this guy? Because that's not a molecule. And it made me sort of aware that all of my criticisms of all of my professors and people who have to stand up and teach things probably were somewhat unjustified, because I made that mistake, and I totally know that it's not a molecule. So shout out to all my professors. Thank you for choosing to get up there live and make those mistakes to educate me. Thanks, guys. See you next week.